So what are the different factors kind of related to fertility? I like to say that usually 99% of the time, it's never one person in the couple with the main diagnosis. It's usually something going on with kind of both partners overall. So we usually say, it's about a third and a third and a third. A third is kind of female factors, a third is male factors, and the other third is kind of generally combined. Overall, once we've kind of gone through the testing, there's different, and we use this word factor quite a bit: ovulation factor, tubal factor, uterine factor, male factor. All that means is like, what specific clue did we find that's kind of pointing us in the direction of that may be kind of what's going on. Fertility testing is imperfect. We're looking from like the 30,000 foot view, what's happening. We can't see what happens when the egg and the sperm come together. And so you have to go in knowing that we'll definitely get answers, but sometimes the answer is that everything's normal. And that happens, it's called unexplained fertility, about 15 to 20% of the time. And that is a little bit frustrating because there's no answer that we found, but it's also by far the best prognosis. So in that follow-up visit that I do, we'll talk through what factor we think it is or what combination. From there, there's kind of two main types of treatment. They both happen to start with I, and we use a lot of acronyms in our field, like a lot of other medical fields. So one is ovulation induction, which we call OI, combined with IUI, and IUI stands for intrauterine insemination. That's kind of helping a woman ovulate or release an egg, and then help kind of, I call it a limo ride for the sperm. You wash the sperm, get the best concentrated sperm, and you put it directly back inside the uterus. That is usually the first recommendation for treatment because it is low intervention, lower cost, and it has pretty good success rates. The success rates generally are about 15, 20 to 20% cumulative, meaning after attempting usually anywhere from 1 to 3 IUI attempts. The other treatment is in vitro fertilization. That is much more kind of heavy duty. It requires a lot more medication. It is higher cost and certainly higher intervention. And with in vitro fertilization, the word in vitro, or that term, means that the egg and the sperm meet outside of the female reproductive tract, and that happens in the lab. And that's when we really partner with our embryology team to help support that, and it's very much so a team effort. IVF is much more successful. There's also the cost, which, at Arbor Fertility, we are very cognizant of. But overall, that is something that we usually graduate to. Start with low intervention and then move to the in vitro. If we see folks of all different backgrounds and really welcome that. I'm thinking through, I've been practicing in the area for close to a decade now in Missouri, and I've seen folks of all different walks of life, all different stories. And so, unfortunately, infertility doesn't discriminate overall. So I want everyone to feel welcome when they make that first contact and they meet me, that knowing that there is no judgment, and it is just simply kind of helping someone come, to kind of their goal of family building. Our motto is grow your family tree, and we obviously are focused on the patient, but we also understand that it's not just the patient. There are potential grandmothers, grandfathers. There's so much of a support overall, and we know we're kind of helping everyone with that. In terms of patient stories, there are so many. One patient story that always comes to mind is really because it's a particularly unique one, but also because this is a patient and family that we've become friends over the years overall. I saw them and gave them a diagnosis of something called polycystic ovary syndrome, where folks have a higher egg count and have trouble ovulating. And what we found with both kind of the ultrasound testing, but also surgery, is that what we call in our field a uterine anomaly, which means that the actual shape of the uterus was different. And we found that everything had been duplicated. Second half was almost hidden, and so it required really careful surgery to find them. We started with ovulation induction and IUI, and then that did not work and had to move to in vitro. They have a beautiful baby girl who's now 2 from in vitro fertilization. We do this because it ends up being a long-term friendship and relationship. I love to watch the little ones grow, And, there is twins, singletons. We like singletons in our field overall. But, folks are coming from all different areas of Missouri and beyond. Arbor Fertility is located in the St. Louis, Missouri area and the surrounding regions. We have 6 locations. Our main location is in Chesterfield, and we also have our procedural location in St. Peters, St. Charles, Fenton, Creve Coeur, and I'm very excited to announce that we now have a location in Columbia, Missouri. I was previously at practice at the University of Missouri, so it was really a dream to kind of be able to go back to that area.